So thanks for the introduction. As it was said, my name is Robert Kish and I'm working for Mcule, young company. So the main goal is, as you referred to, be the drug discovery platform. Mcule.com is actually a website, so basically the platform is there. It's accessible there. It was primarily designed for computational chemists, and so all the tools are there, or the drug discovery tools are there. We also provide the chemical space for that. We also provide the IT. This is all integrated together, and we wanted to make this system more easily accessible for medicinal chemists, so we designed a simple interface they can use to basically access these tools and get answers to their questions. So it's probably not an excuse, but so sorry for this very long title. At the time of the abstract submission, we didn't really have this this word for this expression for this product. So I'm just going to switch to the idea validator. This is how we call it. Right. So this is just to give you a short overview of the Mcule system. So at the top you can see all the, so basically there's a chemical space you can work on. We provide you the Mcule database, which is contains about 4 million unique structures. All of these are purchasable, and we provide the IT. As I said, everything is running in the cloud, and we have drug discovery tools for you. All of these are integrated together. Right. So you have seen this process several times before, and it's actually being kept reviewed by a lot of people to find out what we are doing wrong. And because that's the output at the moment, and of course there are some promising signs, but we actually have to review all these phases and to improve all these our activities in all these different phases. So obviously you have to find the right target, you have to validate the target, you have to start with some suitable chemical starting points, you have to optimize them properly, and so on. So I will focus on today on the hit to lead and the lead optimization phases, where probably these are the phases where which needs the most collaboration. Here we have to utilize all the knowledge and experience of computational chemists, lab chemists, and pharmacologists. And basically, so the problem is that these competencies are separated, so we don't have individuals that has all this knowledge. So basically, CompChem and lab chemists, they need to collaborate. And this is something they do, certainly. So they have project meetings and to discuss certain ideas and things. But if you take a look at this this picture, for example, so this could be done more efficiently. It's like if a medicinal chemist has an idea, it's typically like he draws it, maybe send this to the computational chemist. They start to discuss it, or they just schedule a meeting. And then the computational chemist comes back from a holiday, starts building a model, validate it, then he can validate the idea. And unfortunately, so the project has been already stopped before the medicinal chemist comes back from his holiday. So it's a problem. So how could we do this more efficiently is the question. And we designed a simple interface to facilitate, to make more efficient the collaboration between the medicinal chemist and computational chemist. This is called the idea validator, and what it does is actually, so the medicinal chemist can draw in a structure, select the project he's working on, and he gets a simple answer. Go or no go decision can be made based on this. As I said, this is a very simple interface, and a lot of things can happen in the background. But at the end, this is basically what the kind of answer they are looking for. So they have to make this decision at some point. It's not like, yeah, this compound is promising, but has a lot of drawbacks, so I'm just going to synthesize half of the compound, or anything like that. It's of course not possible. So they have to make this decision. whether an idea should be synthesized or not. Right. Yeah, and as I said, at the background, a lot of things can going on, and this is basically the Mcule.1 website. So this part can be designed by the computational chemistry group, and of course we have some suggestions, but this is the part where business rules can be applied, and of course all the sites have their ideas how this should be done. But basically, so the computational chemist can build up a model. He can put simple filters together. This can involve property filters, include as well as docking, for example. So these things can be put together, and the thresholds for giving a go or a no-go decision can be of course set by together with lab chemists and everybody who has to participate in this decision. So that's the basic idea. And so what can we predict? We of course can predict activity by, for example, structure-based method by using docking. We can predict activity by ligand-based approaches. So for example, at Mcule.com, BioSolve-IT's F3's tool is also available. This is very useful for scaffold hopping, for example. But other similarity searches can be done based on typical fingerprints. And so basically, it doesn't have to be just a linear workflow. So you can do docking as well as similarity searches, and you can apply consensus scoring at the end. And what the medicinal chemist will get is just right at the bottom. So basically, he gets a score, which helps him to decide whether this compound should be synthesized or not. Another potential application of the idea validator is target profiling. So if you're doing, if you're working on a project where you need to identify a dual acting ligand, or you are interested in the whole in activities in the whole target family, for example, then you can do that as well. And this is something you can get, for example, the results. So the targets with the highest probability for these ligands being active on, and this can be also interesting for. So another application for this is if you have hits from phenotypic screening, for example, and if you're looking for the mechanism of action, then we can do a target profiling as well, suggesting the most probable targets for your compound. And of course, physicochemical properties are playing a very important role during the optimization. So we have to keep this in the acceptable ranges, unless we end up with an unsuitable ADME profile and compounds became toxic or having bad pharmacokinetics at all. So these can be done by very easily. Can be set very easily at the computational chemist interface, and something similar can be displayed very easily. So we can calculate log P and molecular weight and so on. Also, what we can calculate is toxicity. We can look for certain functional groups that are highly reactive, for example. But we can apply also similarity searches on database of toxic compounds. And of course, another thing we can do is, since we have the Mcule database, which contains 4.2 unique purchasable compounds, we can also say that the compound is actually purchasable, so you don't need to start synthesizing it. It's always cheaper to buy it. Yeah, and then you can maybe go to the website, check which vendor is selling the compound, and you can just, by a few clicks, you can basically also start the ordering process if you like. Right, so just to summing up, the idea validator can increase the efficiency during the optimization phases between the computational chemists and the medicinal chemists, and Basically, what it provides, it's a more complicated, complex interface for the computational chemists, and a very simple interface for the medicinal chemists to help prioritize their ideas, and so they can make go no-go decisions on their ideas. It gives a very fast feedback, and it can be also customized based on business rules. And so currently, so the major applications could be to predict activity, do a target profiling, calculate NMAP parameters, and check whether the compound is available for purchase. Okay, and we also prepared a poster for the signing session. It's going to be tomorrow, so if you would like to discuss this in more detail, then just let us know, and let's find us during the coffee break or during the signing session. Okay, thank you very much.